Hello, my name is Kenny Bird. I'm the pastor of Nashville Baptist Church here in Nashville, North Carolina. Thank you for joining us for this time of discussion. I am talking with Amy Thomas today, soon to be Dr. Amy Thomas. We're excited for her and everything that she's accomplishing and all that she's doing. She works in public health and presently is at the School of Public Health at UNC Chapel Hill. She's worked in several different health departments and other agencies around the state, and we would like for her to share some of her knowledge with us. And as we continue to deal with this COVID pandemic and this global pandemic that's affecting us, we determined that it would be beneficial to seek further information and advice from a public health official such as Amy, who's a part of our congregation. We're so glad to have her and her family. And during the early months of the pandemic, the leadership team reached out to Amy. She met with us and she shared her knowledge, her advice, some recommendations as we developed guidelines of how we would use our facilities, how we would carry out activities, and the eventual return to in-person worship so that we could do that in the best manner and the safest manner. We're now at a point where we're in the 8th month of the pandemic affecting us here in the United States. Of course, it started much sooner in other portions and areas of the world. But now, as we've been dealing with it, and it seems that things are beginning to take a different direction than we really would like for them to take, we felt it would be a benefit for Amy to come and share with us. And we hope that this will be informative to you and to anyone that chooses to watch this video, especially our congregation. First, I'm going to ask Amy if she would to introduce herself to us a little further and give us some more information about herself.
Thanks, Kenny, and thanks for this opportunity today. I'm so impressed with the things that the church has done during the pandemic to protect the congregation and our community, and I'm really happy to be here and speak. Yeah, my background is I'm one of the lucky ones. A lot of people fall into public health. I've been in public health my entire career, and now that I work at UNC Chapel Hill, I do a lot of work with improving capacity and leadership and administration of public health across the state. But before that, in my first career, I guess you could say, I actually did infectious disease epidemiology full-time. I worked for the state in South Carolina, in the era after the anthrax attacks and the bioterrorism time when there was a lot of funding and a lot of infrastructure building. So I built my career kind of on infectious disease, and then worked in North Carolina locally in health departments and emergency preparedness and infectious disease epidemiology, including during the H1N1 pandemic. So I have to say I miss it a little bit now being at UNC and not being hands-on, but still I'm able to do quite a few things at UNC to help our partners across the state.
Wonderful. I have several friends that know Amy, and she works with them closely, and everyone speaks very highly of you and your abilities and your knowledge. And so we're so glad to have her here to share with us now. And just to start out, if you could just give us some background on COVID and how we got where we are at this point.
Yeah, so COVID, I have to say, took science a little bit by surprise. We were kind of waiting for the next flu pandemic to happen. We know that flu pandemics happen over time, over a couple of decades, and it had been 100 years since our last truly large pandemic. So we were waiting for that to come. A lot of preparedness had focused on influenza, not something which is a SARS virus. Actually, a coronavirus is why it's called COVID-19. It's short for coronavirus disease. Coronavirus is actually the same type of virus as your common cold. It's in the same virus family as a common cold. So there's tons of strains of coronaviruses. And back a couple of years ago when we had the SARS outbreaks that were mostly in hospitals and whatnot, same type of virus. So this coronavirus came out in China. Wasn't reported till about January, but we believe it went back into October, November, transmission there. So what it is a new virus to humans. Mutations, things like that. The virus mutated to a point where humans have never seen it before. And so what that means is that we're all susceptible to the virus. And so that's why we're in the state that we are now, where we have a pandemic, because everybody is susceptible.
As we continue to hear reports, and it appears that much is happening, and from what is being said, the numbers seem to be going up. Is it getting worse? What are the projections for the future?
Yeah, so unfortunately, coronaviruses in general, you might notice you get more colds during the winter season. We certainly see seasonal flu during the winter, and some of that has to do with the seasonality of the virus, but a lot of it has to do with, number one, UV light has some effect on viruses. So during the summer, you have some mitigation through that, but also people are indoors more during the winter. It just makes sense, and they're in closer contact. So we're used to seeing more colds, more flus during the winter. So it's not surprising, and I think it was pretty much predicted that the COVID-19 would pick up during the winter. There was definitely that possibility if we didn't take the protective measures to keep it from happening. So unfortunately, it's not unpredictable, but the numbers truly are picking up at a pretty alarming rate, especially in states who didn't take some measures early on. We have the mask mandate in North Carolina. Some states didn't have that for a long time and are now learning the hard way and starting mask mandates within the past couple of weeks. Same things with closures and restrictions. North Carolina went into that a little bit in the spring and summer, mitigated a little bit of cases, and now these other states are having to do that. So our numbers are very much picking up. In North Carolina, we are now seeing the highest numbers we've seen through the entire pandemic. Over 4,000 cases on average a day right now, which is a lot. It's a lot of cases, and people sometimes ask, but we're testing more, so shouldn't we see more cases? And that's absolutely true. When you test more people, you're going to get more cases. But we look at things like percent positivity rate. So what percent of tests are coming back positive? So that kind of negates that other argument. And right now, that's much higher, that positivity, than we want. And also, unfortunately, another way to see about how many cases we have and if the pandemic is escalating is hospitalizations. So thankfully, since the early days of the pandemic, we've got better knowledge about how to treat patients who have severe illness. But we're seeing more hospitalizations today in North Carolina than we've seen the entire pandemic as well. And so that's not the way we want to go, especially when it's also flu season and pneumonia season and people are going into the hospital. And then lastly, we're starting to see an uptick in deaths, not too much yet, but typically the deaths follow the cases. So we will probably see that in the next couple of weeks. So we're really kind of at a tipping point now where we're seeing more cases than we ever had. And unfortunately, we're entering kind of a high-risk season with the holidays where people do want to get together and things like that. So unfortunately, cases are rising, and they could rise even more in the next couple of months.
Are we, and you said in North Carolina, of course, the numbers are showing for our local area, does it seem to be centralized in different parts of the state, or how is, I guess, overall, how's it looking?
In the early days of the pandemic, we definitely saw clusters and increased cases in urban areas. So Wake County, Mecklenburg County were very high. As the pandemic has gone on, we've been much more worried about rural areas and spread in rural areas. And so something the state's done recently is actually classify each county and kind of given them a risk portfolio. And Nash County, thankfully, is in one of the lower ones, but our neighbor Wilson is in one of the highest ones. So people don't stay in the same county. They travel borders to work and live, and so I wouldn't take that too seriously. If one of our neighbors is high, then we have the risk to be high. So we definitely should be concerned in the county. And at the end of the day, almost 100 people just in Nash County have died of COVID complications. And, those are people, those are faces. It's tough right now, I think, for healthcare workers and public health workers. Most of us are just seeing numbers, but there are faces behind all those numbers, and it's tragic to think that we've lost 100 people just in our county from a virus.
As you've given us, thank you for that overview, bringing us to where we are and what's happening. The discussion continues, and this is one that, unfortunately, most people, of course, don't want to hear this. But is there a possibility, or does it look like there's the consideration of a shutdown or a stay at home again or something such as that?
Yeah, so as I mentioned before, there are some of the states that were not hotspots early to begin with. So your North Dakotas, your South Dakotas, a lot of Midwest locations, Michigan as well, have just within the past week put restrictions in place because their numbers are climbing so high. In North Carolina, we're in what's called phase 3. There's still some restrictions, and the governor did go back about a week ago and pull back again to asking for indoor gatherings to be 10 or less, except for religious services. So it's the possibility we could always come backwards, but I think the way to look at that is we don't have to go there. It's individual responsibility to take these protective measures. If we can bring the numbers down, there's no reason to shut things down. And if you're interested in keeping our economy strong and things like that, let's not give anybody a reason to even have to think about that.
And so in considering that, as we have heard, these terms that have become just a part of our vocabulary now, masking, social distancing, and other things such as that, what are the best protective measures? We've had things kind of change in the beginning, and as you've said, this is something new, and it's you're learning on a daily basis. I realize that. And at one point they said this, and then as they've learned and as they've considered things, it has changed. So at this point, still considering masks and social distancing, what are the best ways to deal with this?
Yeah, and you have to stay current on this, unfortunately. So you mentioned, we're learning things all the time, and science is a great thing. And with science, you never really reach the answer. You're always questioning and looking at other evidence and things like that. And that's a wonderful thing when you're a scientist. It's not a wonderful thing when you're dealing with science like we have. So back in March, you may have heard, masks don't work. Well, it's because we didn't know then. We didn't know. We knew with perhaps flu viruses they didn't, and that's the best knowledge we had. We had to wait for testing to happen to figure out how that worked. And at first, CDC said, wear a mask for other people. It may not protect you. Now the newest evidence is showing actually it can help you as well as the other person. So you definitely have to stay current on these things, as frustrating as that may be. But what we know today is that the best measures you can take are certainly to keep your hands clean. Right? We learned it in kindergarten. Wash your hands. Hand sanitizer, thankfully, is effective against this virus. So keep your hands clean as much as you can. Also, physically distance. And we like to use the term now physical distance because I think early in the pandemic, people heard social distancing. And we don't want you not to be social. We want you to interact with people in safe ways. So we say physical distancing now. And in general, that's staying away from people up to 6 feet. And it's also masking. So masks are shown to be effective. And like we said before, early evidence showed that wearing a mask keeps the other person, if you're infected, knowingly or not, whether you have symptoms or not, it keeps other people. So we're encouraging people, wear a mask to protect others. But the latest evidence shows it does not only that, but if you're around somebody who's infected, it keeps you from getting infected as well. So masks are really the best thing that you can do. Cloth masks are fine. Replaceable surgical masks are fine. Some people like to use the face shields. CDC does not recommend the face shields. And the reason why is because face shields are actually not meant in any way to protect your nose and mouth. They're meant to protect your eyes, actually. Okay. That's the purpose of face shields. And so the open areas underneath your chin and on the sides can actually bring respiratory droplets directly into your nose and mouth. So they're really not effective without a mask. If you want double protection, you can wear a normal mask underneath and then a face shield. So those are the biggest three things, and certainly when you're inside with a lot of people, masking is really important. But then if you tolerate masks well, even if you're inside a house with other people that you're not normally around, wear a mask. If you're outside and you might come into contact with somebody, wear a mask. And the reason why is because we don't realize sometimes when we're wearing it or not, and we're used to going up to somebody and have a conversation. So you could be in your yard raking leaves without your mask on, and somebody come down the street, and your natural inclinations to go in, give them a hug, say hey, and then you're like, oh goodness, I don't have my mask on. So the more you have on the mask, more you get used to it, and you're always protected.
In some of the cases, it seemed, in trying to wear the protective measures or use the protective measures and still try to realize what's going on, does it appear that the virus or COVID, it is so much based on a person's physiology, it affects, there seem to be some people that may have it but be asymptomatic, you know, and there's some that's severe. So has that been one of the difficulties?
Yeah. Absolutely. So, we've talked about flu viruses and preparing for those. Lots of times pandemics, the elderly in our populations actually have some immunity to a past virus.
Yes.
And so when we see H1N1, for instance, we always worry about our elderly with flu, but we didn't worry about it that time because they had some protection. With this COVID, nobody has any protection. So it's been really difficult to figure out who is at high risk. We just don't know. We do know that people over the age of 65 are considered high risk, and then people with underlying chronic conditions, so diabetes, heart disease, stroke, obesity has been shown to be a pretty significant risk factor. But why somebody is symptomatic and somebody's not, we don't know yet. And then with children too, we know that most children, even when they get infected, seem not to have symptoms and thankfully don't seem to have severe cases. But then again, all of a sudden a child will pop up with a severe case and die, and we don't know why them and not somebody else. And so that's why it's important for everybody just to take the precautions, because we just don't know this risk profile right now.
Have there been cases where a person that has had COVID has contracted it again?
Yeah. So again, not a lot of research on that yet, but we have, the literature is showing a couple of cases, at least a couple of case studies, where they have shown somebody to get reinfected.
Does it seem to manifest itself differently, or?
Not necessarily, and I don't think there's enough cases really to show.
Yeah.
So I don't think we can say one way or another. I would just say from a personal standpoint, I wouldn't risk it. It's not worth the risk.
Yes. Oh, yes.
Yeah.
So as we consider trying to take the protective measures, trying to practice physical distance instead of social distance, and understand what needs to be done, are there some thoughts that you may have specifically for, say, a church as we're trying to gather? Because I do know that I've read some things myself that talked about where there have been clusters occurring from churches gathering.
Yeah.
And so I guess this could be general for any gathering, but say specifically for us as we're planning, as we are back in the sanctuary worshiping, as we're trying to determine the possibility of activities with children, as we're trying to slowly get our music ministry back, because I read one thing where it talked about singing, just really throws it out there.
True.
So what are some specific thoughts you might give to a church?
Yeah. So unfortunately, we have seen some outbreaks in churches. There's one significant outbreak still occurring, unfortunately, in Charlotte right now in Mecklenburg County, where there have been a number of deaths, lots of cases, from a week-long event that they had. And from what they can tell thus far is there was not a lot of adherence to the protective measures. So I think as far as churches go, again, the state right now is limiting gatherings inside to less than 10, but churches are excluded from that. I think it's all about how seriously the congregation takes it and how people take responsibility themselves to protect themselves and others. And, I'm someone right now who I've sent my children to school this week. They've been in school around 500 other kids and teachers this week. But they are young, and for the most part, they're faring well with COVID. I feel comfortable with the measures that are in place at their school. If I didn't, they wouldn't be going. I feel like that's the same with the church, except that we know our church community is not just little kids who aren't at high risk. We know that our congregation does have people who are at high risk. And so it's really important, I think, for us as a church community to protect not ourselves, but really protect those others in our congregation. And if people feel, that they're at high risk or have any concern, certainly the recorded sermons and everything are such a great opportunity for people. But I definitely think gathering, if people are doing it in the right ways, that's being shown to be okay for the most part. But again, I think everybody has to make their own decision about their feeling of risk.
And that's early on while we approached you, and you really were very helpful as we determined trying to plan ahead, and as we have tried to make it as safe as possible, and encourage people to come when they feel comfortable. And the streaming, the online venues have truly been a blessing that have allowed people who do not feel comfortable or cannot be out. So that's what we have been trying to do, and we're grateful for the advice you gave us. But are there other, I guess, things or places that you would classify as high risk?
Yeah. Yeah, so the CDC has come out with a number of those. So there has been a recent study where, a case control study where people who were at higher risk for COVID more often went to restaurants. So we know in our state that restaurants are supposed to be at lower capacity. Restaurants seem to be pretty high risk right now. So again, it's one of those things where you can take a personal decision. Go, if you really want to go out one night, go and look at the restaurant, see if they're adhering. If I look at a restaurant and the entire parking lot's full, no way. There's no way they're adhering. Outdoor seating certainly is better than indoor. And we know that it's not transmissible through food. So things like takeout are perfectly fine as well. Gyms have also been shown to be relatively high risk as well. But what we're seeing more lately with the increase in cases is actually small gatherings at homes, small parties. And I think any of us who follow social media and like to follow our friends and what's happening, you see more and more of, birthday party with, grandma's 80th birthday party and everybody, like 20 people standing around and not a mask in sight. Or, this feeling of, it's the fall, we want to have these hay rides together with friends and, we want to do these things for Christmas. And these small gatherings, unfortunately, are what's driving the pandemic right now. And so I would just encourage people to think about those, try to limit those as much as you can, because that's really where we're seeing some transmission right now.
So as of course, as we're moving into Thanksgiving next week, then moving through Advent to Christmas and gatherings taking place, there have been some discussions, I don't know if this is the appropriate term, but talking about congregating with people that are within your bubble, your sphere, your network, or whatever, I guess as you call it. So, and this, of course, I believe is one of the difficulties for many people as they're being told that you can't, have, because we usually as a family, we have a Thanksgiving, it's pretty much like a family reunion every year where we have close to 100 people. And that is, I do not believe it is not happening as it usually does this year. But it is hard for people to hear, go, and if you gather with a group, it's got to be under 10, but then wear a mask in your home or wear a mask around those people that you know or you've been around. So how do you respond to that? And as people have those concerns and they're raising questions and because I guess when you start messing with traditions and things like that, it gets kind of, I'm very set in my ways too, so it's kind of hard.
Yeah, I totally agree. And we are getting into what some have termed pandemic fatigue, right? This has been going on a long time, right? This isn't your normal flu season or something like that. This has been a long time. And I want to say too that it's very stressful for a lot of people who are working from home full time, juggling kids work, but whatever, people in nursing homes who can't have visitors, like it's so stressful for everybody. So mental health and trying to do, what can keep you in a good spirit is really important too. And I think that's another thing I didn't mention before with choosing whether to come to a service. I think you have to take that into account too. If you feel that your spirit needs something, it's important to do. Just take the other measures. And as far as Thanksgiving goes, we're used to everybody around the table and a huge turkey, like, you don't want this sort of turkey for Thanksgiving. So yes, the state and the CDC are saying try to limit it to gatherings less than 10. Try to have it be your bubble or your pod. And that concept is really that, you can't make it and just be quarantined with just the people in your household. You kind of sort of have to expand outside a little bit. So for instance, my bubble is my 2 children, my husband, but also my in-laws to help out. And one other family who goes to school with my kids so we can do some carpooling. And that's where we try to keep it. And so for Thanksgiving, we're going to try to keep it to that, for instance. We're not going to have everybody over. My aunt and uncle are coming from Texas, but they got a COVID test before they left, and they're driving an RV across half the United States instead of flying. So we've put things in place. I don't know if I'm going to make people mask in my house. That seems... that seems a little strange, but definitely make sure that anybody who comes to your Thanksgiving celebration is not symptomatic, of course. but also hasn't been around anybody who's been tested positive for COVID, and people that you feel take prevention measures strongly. You know, that they take them seriously, think it's fine to have. What you want to do is just reduce as much of contact with people. So can they sit at the same table? Sure. Do you want to have the big buffet line where 10 people are touching a utensil? Maybe not. Maybe you want one person serving and touching that utensil, right? Because what happens with a utensil? We touch a utensil, then we touch our face, you know? So looking at infection control like that, if it's a nice day, maybe having it outside instead, trying to separate tables as much as you can. Take common sense approaches and do what you feel comfortable with. And then, look out for symptoms. Actually, keep in touch with those people and see, how they're feeling afterwards and things like that. And no sheriff's going to come knocking on your door if they see 10 cars in your driveway or anything like that.
Well, yeah. that would be something on the family videos.
That would be bad.
Kind of a side note.
Yeah.
Not really talking about holiday or something. You mentioned testing.
Yes.
And that is something that, of course, has developed over
Quite a lot.
this period of time. And they're trying to, of course, they talked about one of the big things was rapid tests, trying to get it where it did not take as long.
Right.
And someone mentioned, is there a discussion of a take-home test?
Yeah, so testing has gotten much better throughout the pandemic. It's much more available now. It used to be it could take up to 7 days to get a result. Nowadays, most places takes 2 to 3 days. So we're seeing much quicker, not only access, more available access for people. Either that's their health department. You see down at the health department here, they keeping a tent outside and doing drive-through testing. That's available. So there's much more testing available, and it's quicker to get your result. There is something called a rapid test that some physicians use, and that rapid test physicians do have to use. It's kind of like it's your flu test. If you go in and get a flu test, they can give you a result in about 30 minutes. But those have to be administered by a physician. There are now at-home rapid tests. The way those work, you actually have to go to the manufacturer's website, talk to them about your symptoms, and they decide whether to mail one to you. They mail it to you. You administer it yourself. Some are saliva. Some are nasal swabs. Don't know if you want to do that to yourself or not, but you can administer yourself. And then you mail it back the same day. And they say from the time that they get it, it takes 24 to 48 hours. So I would say the challenge with those and why I wouldn't jump to those automatically is because, number one, you can get results from an in-person test quicker than that, right? By the time they ship it and all those things. Secondly, it's still up in the air whether insurance covers that test. If you have to pay it out of pocket, it's $100 plus for that test. And the third thing is, in general, the data that we're getting from them shows that they are effective. They have a high reliability rate, but they have been passed by the FDA under something called emergency use authorization. And that's something that's allowed during emergencies like this to get things out as soon as possible in an emergency. So what that means is the FDA feels it's safe. They have no reason to think it's not safe for somebody, but they haven't gone through the rigorous efficacy testing that you would have for a normal test. So it's authorized by FDA, not approved, you would say. So as long as you're able to get a test in person, you can get to one, and you get your results quick, I think that's the better way to go.
Okay. Well, that's good to know and good advice as we're trying to consider what to do, because I know it is a little unnerving as you move into this season that you were talking about, and someone coughs next to you or sneezes, or you yourself think, well, I don't know if I'm experiencing something, but they do seem to be offering many more testing sites, like you're saying,
Right.
And everything's drive-through now.
That's
it
right.
seems. So it's it's drive-through. We've had drive-through meetings here at the church to do things. And I know that as we move into another area that seems to be, I would think, of great interest to most everyone, that's the vaccine that is being discussed. And I've been trying to keep up with it myself and watching the different companies and waiting for that moment when they would say that they've come to a point with one. And now we're starting to hear. So how do you see, or how is, I guess, the School of Public Health and the agencies, as y'all have discussed this, do you consider it safe, and would you yourself be willing to take the vaccine? Would you have your family vaccinated?
Yeah. So, admittedly, this is the quickest discovery, ramp up production testing of a vaccine we've ever had in the United States history, without a doubt. So, I think the first thing that would come to people's concerns is about safety of the vaccine. So, there's two different things at play. Is it safe? And also, is it effective? Is it worth getting, right?
Yes.
And so, as for safety, these vaccines, the Pfizer, the Moderna vaccines that you may have seen in the media lately, they have gone through strict FDA safety trials. There have been other vaccines across the globe, specifically in China, where they found vaccines not to be safe. But we feel very strongly in the United States, as these have gone through the testing they need to be safe. As far as effectiveness, it's always the case with vaccines that they're never 100% effective. Not everybody's body responds, their immune system responds to a vaccine in the way it should and gives them immunity. So when we think of flu vaccines, from year to year, 65 to 70 maybe % effectiveness.
So the numbers for this vaccine, you made, are they
Almost 99%. It's
is it for
really
real?
high. It is. It's hard to believe it's for
It is,
real,
it is.
but it is, because I think I questioned it when the Moderna came out first and said, we're seeing 99% effectiveness. That's just kind of unheard of. But then when Pfizer came out with theirs and it was the same, yeah, it's certainly a possibility, because we've never made vaccines against these coronaviruses before. So there's no reason to think that those two have come through. The fact that two separate manufacturers, drug companies, are coming with the same effectiveness, I think is compelling. It seems like it's going to be a very effective virus, which is fantastic. Would I take it myself? I think a lot of things come into play. And again, I think it's one of these things where it's not black and white, and everybody has to make their own choice. If you're at high risk, if you're over 65, have a chronic disease, something like that, you don't want to get COVID, and you want to take every protection you can. So I would definitely advise them to get the vaccine. When we talk about safety trials for vaccines, what's not tested are certain segments of the population, like pregnant women, for instance. If I was a pregnant woman right now, I would not take the vaccine. I'll be honest, I wouldn't, because it hasn't been tested for safety in pregnant women. So I would wait until those results come out. But for me, as a generally healthy, middle-aged person, and for my children, a 9-year-old and a 6-year-old are generally healthy, absolutely, I would take the vaccines that they're currently talking about coming out now.
So it's simply the same. Well, it's not exactly the same, but along the same line of each year, if you do, you take your flu shot, with just the expectation, hopefully, that it will protect you, or if you do contract the flu, it's supposed to not be as bad.
Exactly.
And so is that the premise with the vaccine as well?
That's the premise of the vaccine, and the other premise of the vaccine is that we need a lot of people to get it. So that's how we get by, for instance, with a measles vaccine that's only 90% effective, because enough people are vaccinated that we don't have to worry about that other 10%, because there's no cases out there, because, nobody's sick. So that's the other piece to this, and people ask, like, when do you think we're going to get through this? It's up to us. It's not up to government restrictions or anything like that. It's up to us taking our personal protective measures seriously, enough of the population getting the vaccine, that we can help get this virus and erode it away.
Well, of course, there are many people questioning the vaccine, even with those high numbers, and that's why I kind of asked you. I said, is this for real? Because it's phenomenal. Hopefully, if that is the case, and kind of trying to consider what the options are. And there have been many discussions about herd immunity. And with COVID, because I've read several reports and papers, there were discussions that several countries in Europe tried this. And at first, they were saying, oh, it looks so good. But then later on, it wasn't so good. Is that feasible?
Yeah. First of all, it's hard to compare us to other countries. So one of the ones that's been in the news a lot is Sweden. Sweden did not take any measures to shut down in any way, do mask mandates. What they did was they encouraged people and they advised people to wear masks and to take all these measures and to quarantine and stay at home as much as they can. A lot of European countries were not built on democracy like the United States, and our sense here of independence and self-choice and things like that. It's a different culture. And so when a government comes in and says in some of these countries, you should really do this, people do it. And
Yes.
they don't question it. So it's you can't really compare the two. But we do know from Sweden, for instance, that laissez-faire way of looking at it has not worked. And as far as herd immunity, yeah, I mean, when you think about herd immunity, the concept really is if we can get enough people who get sick and then therefore get immune, then there's less sick people out there and the others are going to be okay. Well, that's assuming that you can't get the disease twice. That's first thing, and we don't know that about COVID right now. And another thing is it depends upon the disease severity. So, back in the day, I remember when I was in kindergarten, parents used to have chickenpox parties, right? Let's go, because rarely did children get severe symptoms from chickenpox. And so instead of chickenpox getting you midway through the kindergarten, let's go ahead and knock it out at the beginning. Let's go ahead and get it for you. That's the concept of herd immunity, right? Let enough people get sick and get immune where you shut down the disease. Again, the problem with COVID is you might get it again, but also who are we going to allow to get sick? Because we don't know which people are going to have the more severe cases and get very sick or die. So it's playing a little bit of Russian roulette, I think, to think about herd immunity with COVID.
Because that is, as I said, that's been in several of the just published articles and things that I've read as they've talked about it, and I read, like you were saying, specifically about Sweden.
Yeah.
And it was two different stories from where it started and then where it ended.
Yeah.
And I think, of course, there's so much confusion, Amy, and fear, and we just don't know.
We don't know, and I think we would like to have easy answers on how to. We would like for the science to give us an answer right now. Yeah. We would like to make easy answers and say, well, all colleges and universities should be shut down. At the end of the day, that's not the way the world works. And coming from UNC, I can say that very strongly. UNC didn't quite do it right. And I almost think for some of these large universities, where so many students are off campus and there's so many students and they're in a college town and can infect other people, you could never keep that bubble. Yeah. But in other places and other smaller universities, it's worked. So I think it goes back to making individual choices based on your specifics and also entities as well.
And that's exactly what we as a family have experienced. My daughter's at a smaller school, and they've maintained. They did have to have a 2-week period where they went back to just all online, because they did have some cases. Yeah. But they jumped immediately to try and take care of things, and it's a much smaller nucleus, like you're saying, than you're looking at a large university. Right.
And that they were flexible, right? They had a plan, but they knew once they got to a certain point, they needed to back off, then they could go back. And I think that's similar to the church, and seeing what's going on with the congregation and what's going on in the outside community, and being able to shift and be flexible based on what's going on and make the best decisions.
Well, and that's another thing that I keep looking at these empty pews. I looked at them for several months empty, but thankfully we have bodies in them now. That was one of our thoughts, that we had a very high amount of trust in our members, but yet you have no idea the contacts that will be made. Yeah. And so it's a feeling of helplessness.
It is.
When we do everything we can to try to make this a safe environment, because, of course, we feel it's very important to come together to worship our Savior. And as you said a while ago, I do think that there are many people yearning.
Yes.
They need that connection. We have tried to keep continuity throughout all of this. We have never closed. Yeah. Where people have talked about that. We have not had in-person worship, but our office is never closed. We've remained in contact with the members, trying to learn new ways of doing that. but yet there's still, as I said, so much uncertainty
Yeah.
that you cannot control.
Yep.
And so that leads us into, this, I don't even feel comfortable using this word anymore, but trying to consider, the term normal
Yeah.
just it's very loaded now. What is normal? What can normal
Yep.
be? But what do you foresee from a public health perspective of a return, or a thought of even considering pre-COVID conditions, or
Yeah.
or how we're going to move ahead and what it will be.
Yeah. I choose to hope that we don't return to normal. I hope
Yes.
we return to a new and a better normal, not only with people taking infection control and things like that and washing your hands and things more seriously, but, we've talked about a lot of negatives about COVID, but I do also want to highlight that there have been some amazing positive things that have come out of COVID. People volunteering more at food banks and stepping up for their neighbors and doing extraordinary things for people in nursing homes. And and supporting small businesses. And I hope that spirit, we see that after disasters too. We see this spirit in people that brings everybody together, and things like that. And I hope that can continue into a new normal. As far as when do things feel like they're normal again, that's going to depend upon, again, us trying to get this curve back down now through personal protective measures, and then people getting the vaccine and enough people getting the vaccine. And so the vaccine we do anticipate in mid-December, we should start vaccinating in this state. Priority will be for healthcare workers, of course, and
Yes.
first responders and public health workers who are in contact. The vaccine will trickle in. If you remember back to the days of the H1N1 vaccine, we'll get a little bit at a time as production gears up, and so they'll get the first of the vaccine, and then other high-risk populations, so people in nursing homes and congregate living settings, people like that, people with 2 or more chronic conditions, they'll be the next to get it. And then people with 1 chronic condition, and then children K through 12 in college, and then the rest of the population. That will take through the spring to get through without a doubt. So if I could put on, my genie hat, probably the summer, I would think. And that seems like forever. And for somebody who hasn't stepped foot in their office in Chapel Hill in 8 months,
Yes.
this feels tremendous. But we've gone through things like this in America before with the world wars and other things, and people have come together and gotten through it. So I would just encourage people not to give up now. People did so well, for instance, last spring and last summer with these personal protective measures and keeping the numbers down. Don't give up now. We're in the middle of it now.
Yes.
Don't give up all that work now to get infected. So that's what I would encourage people to think about.
And of course, as far as I understand, the vaccine will be
Yeah.
voluntary.
Absolutely voluntary.
And what would we've talked about it some, but what would you like to say to possibly encourage that individual that's having doubts about taking that vaccine?
I would say talk to your public health officials. Listen to the science, and I know that's difficult right now because things are changing all the time. Also, we know we're going to have problems in certain populations, like minority populations. We are concerned in public health that they're not going to trust the virus. They're not going to trust taking the vaccine, and they have more reason than a lot of us because of what's happened to their populations in the past and how public health and medicine have abused them, and certainly they don't trust the system and trust a new vaccine. So we know in public health we're up against a lot. I think you can take a couple of things. Just think it through, weigh the costs and the benefits. Try to get to the actual scientific information about it. Talk to your personal physician. They should be able to advise you on the vaccine too and help you figure out kind of the risks and benefits for you personally.
So as we look and consider and hopefully pray that those numbers for the vaccine come through, I mean, that's phenomenal. And just like you said, it is exciting.
It is.
To hope, and we need that hope.
We do.
There is pandemic burnout, as you stated. And as people are struggling, trying to deal with these things, I can look at my own family. Um, you talked about not stepping in your office for 8 months. I know my own parents, who are very high risk
Yeah.
because of their age and medical conditions, they have found themselves pretty much in their home, except going to visit my sister, or when church finally started back, going there. So that's their sphere.
Yep.
That's it,
Yep.
and it wears on you.
It does.
And so, what are ways that you think that I as an individual can help those that are struggling,
Absolutely.
and be that someone that can make a difference as they're struggling with the physical, the health effect, the mental effects
Yeah.
of COVID, and there are also maybe other unfortunate consequences that they're facing. What are some of the things that you feel we can do?
So I think there's certainly a lot of people who are feeling depression, anxiety around the pandemic, and I think there's a couple of things. I think one is to focus on what you do have and the gratitude for what you have. There's a lot of people around this country who don't have jobs right now. We're concerned about things that happen to children when they weren't in school, and food insecurity, and all these things that are going on. And some of us are blessed to be stable during this time, as difficult as it is. And as you mentioned, there's many people who are not that way. So I would definitely encourage you to think about food banks are struggling right now more than ever. People are having to seek their services, and I myself have I've kept a pretty strong bubble through the pandemic, but found a food bank in Durham that I felt very comfortable volunteering in. So you can do that, or you can just donate. You don't have to actually be part of that if you don't want to put yourself at risk. So I think you can think about that. Thinking about somehow visiting people like you talked about your parents, if they can use FaceTime, or you can drop them a care package. Something I've done for my staff, because we've been remote now for, since March. I mail them a care package every month, just to talk about how we're thinking about them, and just try to bring hope to people who are kind of confined in some way. Definitely maybe care package for people in nursing homes and whatnot, and just checking in on people. You never know what they're going through personally, so checking in on them. And then I think too, showing your gratitude in however way to our healthcare workers, to our public health workers, to our first responders. Of course, you've seen some of this in the media, but they're seeing all those faces behind the numbers, and they are struggling, understandably. They're undergoing severe mental health issues because of what they're seeing every day. And if you can just think about being with somebody who is dying and can't have a family member there, I can't imagine. So in some way, thanking them and showing them gratitude. And I'd say also praying for our decision makers across the country. Whether they're making the right decisions or the wrong decisions, these are really heavy decisions to make. They're very difficult. We talked about the science changing all the time. These are tough decisions to make one way or another, and they hold a lot of ramifications. So I think the more we can pray for them, both in compassion and grace for them, but also to make the right decision, I think is really important as well.
And there's another area that I have really seen the effect because of its personal connection to me, and that is education.
Yeah.
Educators,
Yeah.
teachers, as we call
Absolutely.
them. Last spring, and it's been for me, it's been a total paradigm shift because I can't go to hospitals,
Yeah.
I can't go to nursing homes, and I am a bit anxious about going into some homes for the possibility that I may take something with me to an elderly person or a person that is sick and complicate things. And so last spring, our entire education system, I saw one description was it's like flying an airplane and building it at the same time.
Right.
And I know that teachers and educators are under a lot of stress, and as you said, as the students are going back in, I think they are almost an unlisted frontline worker that a lot of people
absolutely.
don't understand. Well, and you're in education yourself.
Yeah.
You know that. And it is teaching 20 students on Zoom is nothing, or on a screen is nothing like being there in the
Right.
presence, making that connection. And I believe our students are suffering.
Absolutely.
As I've watched our children, and oh my gosh, the first day of school, everybody takes these little snapshots and these little pictures. We've never really done that, but I did take pictures this year because one of our children, we couldn't log in. The system went down across the state, and he was
Yep.
just sitting there with his hands on his head, just, frustrated. And I believe that's something that's been running through so many, and I know healthcare workers have to be frustrated.
Yeah.
I believe those in the education field are frustrated. I believe over, just people in general.
Small businesses.
Small businesses
Absolutely.
have been really suffering as we are losing some that won't come back. And so I do believe that this is an opportunity that's been presented to us, as you're saying, to, check on your neighbors, reach out.
Yeah.
One of the things that I always find so odd, and, we're supposed to be listening to your advice, but I'm sitting here, is that those organizations and agencies and groups that often seek to do good and seek to try to help, usually they're nonprofits, they're the ones that suffer the most in times like this
A lot of them
because,
have closed.
yes,
Many.
as the economy is affected, as you said, there's so many people out of jobs. One of the first things to go, sadly, is giving,
Yes.
because you don't have that, I don't know that extra or whatever. And so it's probably even more beneficial that we as individuals realize we might need to step up because of some of the things that are not happening or cannot happen.
I think stepping up for giving, and I think stepping up also for small businesses. I said I'm not going to go into a restaurant right now. It's my personal decision based
Yes.
on risk. But I am thankfully not cooking every night. And we are supporting
Yes,
takeout
yes.
from restaurants in our area. And certainly as the holidays are coming up and you can
Yes.
buy presents for people, think about supporting our small businesses. So
Yes.
many of them have adjusted and done curbside and other sorts of things. And it's so important to support them too.
This is definitely a time to shop local.
That's right.
And
Absolutely.
we're not doing a commercial or
No,
anything,
but-
but it's definitely
Yeah.
pulling together. I think that's wonderful. Thank you
Yeah.
for, I think that's a good point to pull this together.
Yeah.
And we hope that this discussion has been beneficial to whomever chooses to watch it. We did this, and I really feel like the Lord laid this on my heart some weeks ago, and I had seen in the beginning a church talk to someone, and they were talking about, what is social distancing? What is this? This is the early stages. And as we are where we are, I feel like we need to continually be informed and learn. And we're so grateful to have individuals that the Lord has gifted, such as you, with the wisdom, the knowledge, the information that you have, that you're continually learning, and that you can share, and that I hope people will gain something from this, garner something from it. And we're not all going to agree. We know
Absolutely,
that.
yeah.
As in this nation, we have an independent streak,
That's
as you
right.
said. But I do believe we can work together, and that's when we are at our greatest.
I agree.
And so I truly feel that that's important, and want to provide everything that I can as a pastor for this congregation. And if the Lord gives me a resource like Amy Thomas, I want to use her and let people gain from that. We've had a lot of people step up to do things during this time. It's been very different and at times difficult, but we're moving forward, and that's what matters. And so we are grateful for you joining us this afternoon and this evening, and for everyone that will join us online. I pray that you will continue to be safe, that the Lord will watch over you, your family, and that you'll have a wonderful Thanksgiving next week. And as we move into the Christmas season to celebrate, that we all just make good decisions. And hope you will join us online or in person if you feel so led here at Nashville Baptist Church. So thank you, take care, and God bless.